Hey, let's do another one. I just had the idea. Why don't let's do one about do I need medicine or not for my anxiety? Hey, do I need medicine? Okay, so this is a great question. So let me explain who I am first. I'm Jim McFarland. I'm a licensed clinical therapist and clinical anxiety specialist. So I'm licensed in the state of Georgia and the state of Florida, and and I've been treating anxiety in folks for years now, years. I started out having my own anxiety disorder and having to work with that and having to work my way through it and then learn what actually works to help these things. And then I started, once I got that under control, I really got a hunger to help other people and to really kind of make worthwhile what I went through to help others. So then I started to do that. So nice to have you. So good to have you. So let's talk about it. Let's talk about it. Let's break this down from a therapist point of view, from an experienced clinician. So I got about 25 years of experience. I started out in 1994 and was a mental health technician. It went on by the year 2000. I had earned my master's degree and then my licensure after that, and then so now it's 2022, so over 25 years experience. So there you go. So now, do I need medicine for my anxiety? It's a big question. Big question is super important. Super important. Now, I'm gonna just say this caveat: this is not medical advice. This is not. This is for informational purposes only. This is to help you to understand where to be and maybe what questions to start asking your doctor and your physician, what questions to start asking your therapist if you have one, or to ask your psychiatrist and to work on that. Okay, so first, the first thing is to kind of the first marker that we're going to look at is how much distress am I experiencing from my anxiety? So how painful is this? Is this something that is impeding my ability to work and my ability to actually to be feel fulfilled and kind of at peace at home? Is it making me increasingly more depressed and increasingly so to the degree that it impedes you and that your anxiety is getting in the way of you living? Maybe I've suffered for anxiety for a long time, and it's at high levels. Let's say on a day-to-day basis, let's use this little scale to kind of help you understand. Let's say my anxiety is at a uh, 50 or 60 or above every day, just nearly most days. That would probably be an indicator, and it's been doing that for longer than a couple of weeks. Longer than a couple of weeks. So there's a lot of anxiety that's situational. Maybe our job is changing. Maybe we get some curveball that comes in from some type of illness or something. But in general, we could say, 2 weeks. Anything outside of 2 weeks, unless it's like a grieving kind of loss where I'm grieving the loss of someone, maybe, or if it goes outside 2, 3 weeks, then now we're starting to get into the area where it really is becoming more of a distinct anxiety issue, a standalone issue that is impeding maybe my ability to sleep, maybe my ability to enjoy life, maybe my ability to do things that I enjoy and go out with my family. So that would be one of the biggest indicators. Is it a 50 or 60? So what would zero be? Zero be is I'm totally relaxed, totally at ease. I'm, near sleep. That would be a zero. 100 would be I am panicking, flipping out, losing my stuff. I'm losing my shit. And so there it is. I'm losing it. I feel like I'm drowning. I feel like my nose is barely above water, and it's going down. You know, and I can barely, okay, now those are solid indicators. If I feel like that most days for 2, 3 weeks, got to get some medicine. Usually you want to get medicine going. Now, what types of medicine are they going to prescribe with that? And we're going to use some other criteria too, but let's get into what type of medicine are they going to should be prescribed. Every anxiety disorder in every person is a little bit different, so it'll depend on the person. This is very much an art form. There is no hard and fast rules for what medicine works for whom. A good doctor is going to research and want to know about who your relatives are. If they have anxiety disorders or depression, what medicines worked for them. They're going to want to know that. They're going to want to know. By the way, one of the things that's being marketed to people out there right now is this genetics testing. This is absolute horseshit. This is not true. We don't have the technology yet I've looked at the studies. I've looked recently at the studies, and this is 2022 in October. So there you go. So, and the genetics people have been touting this as like the next thing. Oh, we get the genetics test and we take a swab of your saliva, and then there's no way. There's only a couple of distinct illnesses, diabetes and a couple of others, that are now responding to genetics testing. Psychopharmacology is not. So for any of you that maybe your physician has advised you, or a psychiatrist insists on you getting this, or you've been thinking about it, stay away from it. There is, I've had very few clients that have had results from genetics testing, and I'll just say it. It's just, I think it's bullshit. I think it's the latest snake oil that's being marketed to people. So the genetics and the research just isn't there. It doesn't support that. And then several of the, one of the genetics companies has big lawsuits that are pending against them, and it's just not good. So back to how can we tell what medicine actually works for you? Well, it's still very much an art form. We still don't know all of the mechanics of why these medicines actually help people. What we do know is that they increase the level. Most of them, the first line of defense will be antidepressants. And antidepressants, just because they're called antidepressants, doesn't mean they just treat depression. They also treat anxiety. So, and they do that very effectively. They can do that very effectively. The downside with antidepressants is they work kind of slow. For you to get, some actual bang out of the buck, it's going to take 4 to 6 weeks maybe. And that's if it's at a therapeutic dosage. There are some medicines that will work a little faster in some people, but it's kind of hit and miss. We don't know what that is. We still don't know what the actual mechanisms of action in the human brain are. We do know it raises serotonin, but it does that throughout the entire body. And we do know that there's a waiting period between taking an antidepressant and then serotonin is immediately increased in the body, like that day, right? So if it were all about serotonin and chemicals in your brain, you would feel better that day. But it doesn't. It doesn't do that. What it does is there's a period of wait or latency between when you begin taking these things and when they actually start to have an effect. And the explanation that's normally given in physicians' offices and some less than scrupulous people is, it has to build up in your system. That's bullshit. It doesn't have to build up in your system. It actually is at the level it needs to be at from the get-go. What does have to build up in your system is it seems like serotonin, some research is saying that serotonin needs to be present in the brain for long enough for there to start what's called neurogenesis, or the actual production, like hard-hitting production of new neurons in the brain. And those new neurons allow it to be rewired and allow rewiring to happen and allow new good things to come online. So we think neurogenesis has something to do with this. We know that it's a latent period. We don't know what's happening in the in-between, in that 4 or 5 week period where you're not getting nothing. What's happening in there? We don't know. And we don't know the actual mechanisms of action. Now, what we do know is that these do help. And I can tell you point blank from hundreds and hundreds and hundreds of clients that I've worked with, medicine helps. Period. Anybody that's telling you different or is giving you some bullshit line in some forum, there's research. I've looked at all that research. And the bottom line is I've seen it work and I watched it work on myself. There you go. So now, many of you too will be really, really scared to take medicines for the first time. That's very normal. That happens with all kinds of, that happens with many of the anxiety disorders, and depending on how acute it is or how strong it is, not acute, but what level of intensity you have an anxiety issue, then that can make you either more or less receptive to medicine. And so there's the big fear that always comes in there is, what if I take this and it makes it worse? If it makes it worse. Now, there are some medicines that in the profession, we call these more activating medicines. And these are medicines that we would normally use with someone that, let's say, is, maybe somebody that has a kind of depression that's really where they just want to get in bed and cover up all day and they don't feel motivated to do anything. And I know many of you that are watching this probably feel like that. But when that is just like the main thing that is going on, I mean, this person doesn't have any energy, they don't go to work, they don't do anything, they don't have any energy. They have what we call psychomotor retardation, which is their brain is slowing down. And now for you anxious folks that are watching this, which is all of you, so be very careful when I say psychomotor retardation. Oh my gosh, I got psychomotor retardation, doctor. They're going to laugh. first of all, it is a real term, but I think in general, anxious people are really suggestible. So they're going to tend to think that they got it if you mention it. So it's just how we are. So there you go. So then, some of these medicines would be more activating. And so they may have a tendency to maybe cause some more physical symptoms a little bit, which can be really scary to people that are anxious. So what I would say to you is what you need to do is stick in there, hang in there, continue to take the medicine as your doctor orders. And again, I'm not a medical professional. I can't advise you on what medicines to take and what medicines not to take. What I can tell you is what I've observed with people. And again, this is for informational purposes only. You take this and really evaluate it. Talk with your doctor about it. Talk with your clinician about it, and really get some really good advice about it. These are just guidelines, general guidelines. So for most of you, it'll start out with antidepressant. There are other antidepressants that are less activating. They hit different receptors on the neuron. They're like keyholes that keys go in on the head of the neuron. And based on whatever medicine will go in certain keyholes and kind of fit in them. And depending on which keyhole they go in, it may have maybe a sedating effect, maybe a little bit of a effect, which is really nice. It's very nice to have. So we can use that to our advantage. We could use the other one, the activating ones. Even the activating ones, though, tend to take anxiety away after 4 to 6 weeks. So they will tend to alleviate this. So that would be the first line of choice. They're non-addictive. They don't have addiction potential. And they may have a little bit of psychological dependence that we know of, but they're really, you could stop them. Now, we do know that there are some things, if you stop these medicines abruptly, we know that there's something called discontinuation syndrome. And for many years, it was denied by some of the pharmaceuticals, but now we have proved that does happen. These would be things like brain zaps and feeling like, off balance or flu-like symptoms and so forth. So if you stop these medicines abruptly, you can look forward to some of that. So don't stop them unless your doctor advises, and then your doctor will give you what's called a titration schedule or a step-down schedule to gradually kind of step these down out of your system as you go to try a new one or as you come off of them. You want to do it gradually under your doctor's advision for that. So that'll be the first class, antidepressants. So what's the second and third class? Another medicine that is not in the same class as the antidepressants would be things like buspirone. These are medicines that can be effective in higher doses. They can really help certain people with anxiety. Certainly, they're non-addictive. They're actually helpful with anxiety disorders. I tend to not use them with my clients, or to recommend them to my physicians that they use them. When they consult me and they say, hey, what do you think? And they kind of, when we work together with a particular client, I don't tend to use buspirone because I don't think, in my experience, it has not been as effective as maybe some of the others. But in certain cases, it may help a little bit. There are other medicines besides the antidepressants. So these would be the benzodiazepines, and then also so that may be a medicine that is often prescribed. And I think these are very useful for high levels of intense anxiety. They actually dampen. If we look back at the brain, right, in some of my videos, I talk about this brain. If we look at if we peel off the outer part of this brain and we look at what parts of the brain these medicines are acting on, the benzodiazepines are really cool because they dampen some of the activation that's in the amygdala and in the hippocampus and so forth. So that's really helpful. What that basically translates to is you feel less panicky, and you don't feel as like on edge, and you don't have a pit in your stomach all the time, and you can actually get some rest. Which is important. If we want to look at being able to get rid of our anxiety, we're going to have to start at some point in there looking at what I call good amygdala management. Good amygdala management. What kinds of things would good amygdala management mean? It means you're managing your amygdala, these two little almond-shaped alarm systems in your brain. You're managing them very well. What would manage them very well? I'm glad you asked. So good amygdala management would be, you absolutely need some cardio. I don't care what you tell me. I don't care what I had one guy tell me. Look, if it involves unless it's sex, I don't. If it involves sweating and it's not sex, I don't want to do it. That's what he said. So I was like, ugh. you got to get out there and move. Why? Well, because it completes the anxiety circle. It completes the anxiety circuit. What's the anxiety circuit? Body ramps up, amygdala ramps up, signals threat, pumps out adrenaline, signals to the rest of the body to pump out adrenaline, cortisol, and then that is readying your body for action, to do something. To do something. One of the best antidotes for worry is do something. Quit thinking so damn much and do something. Do it. Right? If that's go out and take a run, if that's go out and go to the gym, if that's go do a real, a Bikram yoga session, whatever it is, get your body moving. That will begin to metabolize these stress hormones that are in your body, and then it completes this anxiety circuit. What your body was just set up naturally to do. It was set up to respond to threat with action, and that is exactly what your body is empowering you to do. So get moving. That's part of good amygdala management. Get moving. So all of my clients, I want them to do at least an hour worth of cardio a day. I don't want to go to the cardio. I don't want to do it. I don't feel like doing it. I don't enjoy it. Okay, well then do something you enjoy. Get on a trampoline. Get one of those little baby trampolines. Go swimming. Get on a bike. Do something. That will actually help you to fall asleep. It'll do all kinds of cool things. It'll release endorphins. It's not the silver bullet, but if there was like a quick, easy thing you could do to lower anxiety, get moving, exercise. You've got to do that. What are some of the other methods of good amygdala management? Well, we want to look at sleep. We want to regulate our sleep. So sometimes the doctors will use benzodiazepines or minor tranquilizers to do that, and those are super effective. The downside is they are addictive. And there are ones that are more addictive and ones that are less addictive. The ones that are more addictive will have shorter half-lives. So meaning if I took 2 milligrams of X medicine, if it has a short half-life, let's say it has a half-life of 3 hours. What that means is when I take 2 milligrams of X medicine, 3 hours later, there's 1 milligram 3 hours later, only 1 milligram in my system. 3 hours after that, half of that, or 0.5 milligrams. 3 hours after that is 0.25 milligrams and on down. So with a short half-life of 2 or 3 hours, the body excretes it very rapidly. Through your sweat, through your urine, through your breath, and so forth. The body excretes that medicine. And the problem with it is it causes rebound anxiety. So with medicines, there are certain medicines out there. Alprazolam is one, lorazepam, to a degree has this, but alprazolam is the one that is the main culprit with this, is because it has such a short half-life, it causes a lot of rebound anxiety to happen. In other words, once it's excreted out of your system, then you have this spike in anxiety symptoms again because it's not dampening your amygdala anymore. Oh, and then what does that mean? That means that the anxiety comes back even harder. And then what does that make you want to do? Oh, wow, what gives me relief is taking one of these alprazolams, so then you pop another, in your mouth and you swallow it and your anxiety goes away again. You go, see, it works. And then the anxiety comes back 2 hours later, even stronger. And so you can get into this cycle where there's rebound anxiety, and I'm trying to suppress rebound anxiety. We don't want to do that if we can help it with medicines. Alprazolam does have its spot in helping with anxiety disorders. It can be really useful in certain anxiety issues and certain anxiety disorders, and we can use it as a tool, and there's a proper way to use it as a tool to actually make you stronger and to make you more able to get past your anxiety disorder and then eventually let go of the alprazolam too. There is a way to do that. I don't have time and space to do it here. We're just doing a general thing where I can try to advise you on questions to ask and things to think about when you're considering, do I need medicine with my anxiety disorder? So then, so we want to look at what level of impairment, how much anxiety am I experiencing? If I can't function, it's a good indicator. If I've had it for a long time and it's not going away, good indicator that you need some medicine. Now, the question that I often that people pose to me is it possible to overcome these without medicine? Absolutely. Now, depends on how long how hard you have to work at it and how uncomfortable you're going to have to be will help to determine kind of how long you've had it, how long you've had the anxiety issue, and how long that conditioning has been going on. If it's been going on month after month, year after year for 17 years, that's going to be harder to kick but it is doable. It is doable. I've watched it. I've watched it done in front of me. Um, that is that's going to be harder to kick than something that's been there for 2 weeks or 4 months. 4 months, okay, cool. The conditioning isn't really set in there. It's not like a groove in a record that's been grooved for year after year after year of responding in the wrong way to anxiety and doing the wrong things that actually strengthen the anxiety. And the brain is more open to learning new opportunities. But it's not to say that somebody that's had an anxiety disorder for 40 years can't get better. That is not true. Oh my gosh, that's one of the big self-talk things. Oh my gosh, I've had this for 40 years, for 30 years. I can't get better. You can't teach your old dog new tricks. Bullshit. Just say bullshit. I gotta call big bullshit on that because I've watched old dogs, literally watched old dogs learn new tricks. I literally had a dog. His name was, what was that dog's name? But he would come into our yard. He lived right down the street. He'll come to me in a second. And he would come into our yard, and he was just this old guy. Ruger, that was his name, Ruger. So he wasn't even our dog. And he would come in, and old Ruger, he'd be there, and he'd come over. And we had little girls at this point. My girls are older now, but at that point they were little. They were 8, 9, 10 years old. So they would love on him. He'd come over, oh my gosh, there's Ruger. Oh, and they'd love on him and everything. And the children over in that other family, they were older, and so they didn't pay any attention to him. So Ruger came where there was love. So Ruger would come coming down, and he'd come and he had arthritis. So his joints were really kind of rough. And so he had a hard time walking, he had a hard time sitting or getting up. But I was like, you know what? I'm willing to bet. Now, I'm willing to bet that Ruger is an old dog. He's an old dog, definitely. It was like, I don't know, must have been 12, 13 years old at least. And I was like, but I know he can learn new tricks. So I literally proved it to myself. I was like, okay. So what Ruger would like to do is when you give him a ball, I just noticed one day when I picked up a ball, he got really excited. And I was like, oh, okay, boy, you want to play? Okay, fella, come on, let's play. And so then I throw the ball, but I wouldn't throw it like 70 yards or 50 yards or whatever. I threw it like 2 feet. He'd get really excited and he'd go pick it up, and then I would go to get it back from him and he would turn his head. He was like, no, you can't have it. That was a game that he liked to play. I was like, oh, okay. So let's see if I can teach you to release this ball. So what I did was I went through this little process with him, and I just went through step by step, the same way I do with anxiety clients, just step by step, little by little, learning more and more until finally, after a short amount of time, I don't say like 2 weeks or whatever, he was able, when he would come up and I'd throw the ball for him, he'd grab it, and instead of me kind of giving the same old signal of going to grab the ball and he'd turn his head, I would say, Ruger, release. And inside of my hand, I had a nice fat treat for him. And I said, release. And then he got used to dropping the ball and following his nose and getting the treat. So eventually I was just able to open my hand and not even say a word. And he would drop the ball. Yes, old dog learns new tricks. Thank you so much. So for you that have anxiety for a long time, so that would be one indicator. Back to when to use medicine. When do we use medicine? Well, it's really impairing your life. You're experiencing, 50s, 60s, and 70s day in and day out. You can't sleep. That would be another one. I can't fall asleep. I'm getting panic attacks at night. I'm impaired from going to work. I can't do the things that I normally do. I'm not going out anymore because I'm scared I'll have a panic attack out there, scared I'll have a panic attack in the stores or driving. So now as anxiety does this, as it starts to gobble up pieces of your life and your life starts shrinking, that's a good time. Probably want to consider using some medicine at that point to leverage you out of that. It'll make it easier for you to understand the principles that I'm going to be showing you and teaching you. It'll make it easier for you to actually apply what's going on. It'll make it so your brain's more receptive, so you want to go talk to your physician. You want to say, hey, I've really been thinking about this. My anxiety is at X level. Here's what's been going on for me. I really think, some medicine can be helpful. So, and I would say, the other thing that I would say to you is the antidepressants, most physicians are very, very open to helping you with those. You may have to get a therapist in some cases before the second kind of medicine, those benzodiazepines, are being prescribed, simply because there's so many people out there that are abusing them. And unfortunately, they've kind of messed it up for the people who really need them. But it is what it is. We are where we are. And so then you want to get your therapist to weigh in for to your physician to help you if you need some short-term, benzodiazepine use. But just maybe pick one that has a longer half-life. You want 15 hours or above, preferably 30 or 40 hours for a half-life. Those are the best ones to use in that case. They have a longer anti-anxiety effect. They don't have this spike of instant, and everybody feels that when they use alprazolam. They take the alprazolam and they feel like, I'm back to myself. No, you're not. You're not back to yourself. You have all of the goodies given to your brain. Your brain goes, oh, we really like that a lot. And then that actually can reinforce the anxiety cycle, as we kind of talked about. So one of the biggest things that make anxiety, that keeps it there, one of the biggest maintaining factors of all anxiety, and I'll say this in other videos many times until I'm blue in the face, will be your avoidance of it. You're getting away from it. You're trying to make it stop. You not thinking that you can handle it. That's what maintains this thing. That's what maintains it. That's what keeps this ball, this wheel spinning. Okay, so we want things that don't give us that payoff. So anything that gives you the payoff of taking the anxiety away in short term, like over a day or an hour or half hour, 10 minutes, your brain's very susceptible to it. It's a principle that we call negative reinforcement. So negative reinforcement is the idea that when we take a medicine, or when we do anything like avoid the anxiety, or we get out of the Walmart, or we don't go in the car, or we go and pull over to the side when we're starting to feel panicky. Whenever we do that, you're dictating to your brain the very factors that maintain the condition. So if I have OCD and I think I've hit somebody, and I'm really worried I've hit somebody, oh my gosh, I've hit somebody, and my brain is saying, go back there and check, that's going to make your brain feel better in that moment. And anything that takes anxiety away and makes your brain feel better in the moment, anything can maintain and reinforce anxiety and make you believe further. So let's say I go back and check. The moment I do that, I do feel better. If I have OCD, I'll go back and I check. I check the weeds. I check the road. There's nobody in the road. There's nobody in the weeds. I didn't hit any animal. I didn't hit anybody. I get back in my car and I start driving, and then immediately the doubt comes back. Now, what happened was when I went back there and checked the last time, I just made that wiring more. I just drilled that groove a little deeper to go back and check again, because now I doubt myself now. Did I really check enough? I don't know. Maybe I missed it. Maybe it was under the leaves. Maybe it was they crawled off into the culvert. And my brain comes up with all of these creative reasons why I need to go back. And what it's really looking for is that shot of feel good to go back. In an anxiety disorder like panic disorder, when I'm leaving Walmart and leaving the store and grocery store, the moment I leave the grocery store, I feel better. My brain goes, thank you so much. Wow, whatever you did, we need to remember that. What the heck did you just do? And then it wires for it. And then it makes you believe that you can't handle what's going on, those physical symptoms that are going on in the grocery store. That's what it makes you do. It makes you believe that you can't handle it. When you escape from it, and it's the same thing that certain benzodiazepines and certain medicines, short-term acting medicines on the brain, that's exactly what they do. They take you through the negative reinforcement cycle. Negative reinforcement is when we take away anything that's painful. When you do that to the brain, when you take away anything that's painful, the brain remembers it very clearly, and then it wires itself for it. So negative reinforcement is one of the most powerful principles in anxiety disorders. It's also very much present in addictions. Oh, I feel, I feel really nervous. I need a drink. Take a drink. Anxiety goes down. I don't feel nervous anymore. Immediately in that moment, your brain says, what the heck did you just do? Because it was real good. And then that compels you to want to go back to the drink again. So negative reinforcement is the way that this is built in the mind, that the mind conditions itself. So we've got to be very careful of what we're doing and how we use certain responses and how we respond to anxiety, because if we're not careful, we can be actually training ourselves to have more anxiety. So if you're popping alprazolam every time you have anxiety, it's not going to get it. Now, I can't tell you what to do. I'm not a medical professional. It's for informational purposes only, but you need to talk with your doctor about how you're using Xanax. And a few uneducated doctors out there will go, no, you're fine. When you feel anxious, that's what it's for. Take it. Stupidity. That is stupidity. That is the wrong way to be using these medicines. That is not the way to be using these medicines to help you to get over this condition. You can use these anxiety medicines to get you closer to the thing you fear. So I use the anti-anxiety medicine to stand in the lobby of the grocery store. It helps me to get closer to what I'm scared of and to learn that I can handle it. That's the proper, appropriate way to use medicine to get over anxiety. So there you go. So the basic idea is if we're impaired, if we're losing sleep, if we're functionally impaired, if my anxiety is a 50 or more most days of the week, constantly throughout the day for long stretches, probably need some medicine. If I have depression that's going along with that, absolutely. If we feel any kind of suicidality or suicidal urges, or I just want to give up, I just want to pull the covers over my head. Again, I can't tell you what to do and what not to do. This is for informational purposes, but I will say to you, you absolutely need to tell your physicians and your therapists that you're feeling like that. And that's a good time to be using medicine. That's a good time. That medicine is a healthy thing. Medicine can be a tool and something that really helps us. So there you go. Hopefully that answers your question. Hopefully that gets you, a little bit more clear on if you need medicine or not. And yes, you need to be very careful about how you use it, because if you use it the wrong way, it'll make your anxiety condition worse. So part of what I wanted to do these videos is tell you guys the truth about how this stuff works and how good anxiety treatment, what it looks like, so that you have something to judge. Oh, this is what it looks like. This is what should be happening. This is what I should be hearing, like that. So hopefully this is helpful. Take care. Go out there and do a little bit of what's scary. That's going to help you. Do a little bit of what's scary. All right. See you next one.